Hello and welcome to today's webinar, Real Bodies, Real Stomas, Getting the Right Fit. Thank you so much for joining us today. Now have a little sit back, a little bit of a relax, because we're going into a pre-recorded presentation at the moment. Stay tuned for afterwards, because we will be going into a live Q&A straight afterwards. So if you do have any questions, please just pop them into the chat and we will do our best to answer them for you. We'll see you at the other side. Hello and welcome to this presentation today. My name's Hannah Patterson and I'm the Associate Education Manager for Ostomy Care at Coloplast. Today we're going to be looking at how bodies change over time and the impact that can have on you and your stoma. So everybody is different. There are more than 648 combinations of bags and supporting products that Coloplast provide. And what that gives us is the flexibility to find the right solution for you. So my first question really to all of you there is, has the shape of your body changed? So why do our bodies change over time? That can be for various reasons. It could be immediately post-surgery changes. So we get that initial swelling and healing phase post-surgery. A lot of people's abdomens are quite swollen post-surgery. And then you get that almost like a deflating, I suppose, over time, where your abdomen can go down and become a little bit softer. Weight fluctuations, now that can include gain and loss. So people can gain weight and lose weight in those early stages post-surgery. Especially if you've been very poorly before surgery, you can gain weight as you start to feel better. And equally, if your surgery has been emergency and you've been very unwell post-surgery, you can lose weight too. Muscle and skin changes over time. This is part of the natural aging process. Skin loses its elasticity and muscles can weaken over time. You can get hernias or prolapses. There's pregnancy, and then even our lifestyle factors. So this can be a physical activity that we do. So what complications can arise from these changes? Our stoma can change in shape and size. We can get the dreaded word leakage, which then can lead to sore skin. You can end up changing your pouch more often, and the pouch doesn't seem to be sticking so well. At this point, I will say regularly checking the size and shape of your stoma is really, really important. And when it comes to defining body shapes, we tend to look at three types of shape. So we have our regular shape, our inward shape, and then our outward or curved shape. Now we're going to look into these three body profiles, as we sometimes refer to them, a little bit more in depth. So what we refer to as regular. So what we're wanting to look at is the area around your stoma flat and even? The area that you place your pouch adhesive is level with the rest of your abdomen. Because when we look at body profile, we're actually looking at that area directly around your stoma. We're not looking all over, we're looking at that area directly around your stoma. Inward. So does that area around your stoma have creases, dips, almost a moat-like appearance? You can see that in the picture there. The stoma almost looks like it's recessed back and there's like a little moated area around it. Or the stoma is not above the level of your abdomen. So if you were to look down, you could almost not see your stoma. Outward and curved. So again, looking around the area of your stoma, is it raised, protruding, bulging, almost looking more prominent and looks different to the other side of your abdomen? Now we're going to have a little look here at the challenges that the outward or curved body shape can cause. This can be causing a lot of problems with leakage, sore skin, because what often happens is we get that creasing to the pouch adhesive. I say, imagine like you're trying to wrap a football up in a flat piece of paper. You're always going to get creases. And then you might get that heavy or dragging sensation to the area, which can be symptoms of a parastomal hernia. But what I'm going to say at this point, curves are normal. We may not want them, we may not like them, but they are normal. And just because you have curves around your stoma, it doesn't necessarily mean you have a parastomal hernia. So what is a parastomal hernia? So this is the point where a part of your bowel comes through the abdominal muscles, creating a lump under the skin around the stoma. So rather than just the stoma coming through, we've then got that area of bowel coming up behind the stoma area, and you get that raised area on your abdomen. Once again, I am going to say it again, curves are normal. Just because you might have a bulge on your stoma doesn't mean that you have necessarily got a parastomal hernia. I've yet to meet an ostomate that does not worry about leakage. So what is leakage? Essentially, we do have two types of leakage. We have the full leakage that everybody dreads. This is where your leak has gone past the base plate or the flange and then onto your clothing or bedding. We then can have more of a partial leakage, so where the leak has not yet breached the base plate and reached the clothing, but it's still visible on the back of the base plate when you remove. Both can result in skin damage, sore skin, and although both can have a different impact on you mentally, both are still leakage. Oh, I think this is quite an interesting figure here. So you can see there's 4 different backs of a base plate there. So what I want you to imagine is you've removed your stoma bag and you're looking at the base plate. So 4 different base plates there. All 4 of those are types of leakage. But that top left one, 81% of people with a stoma do not consider that being leakage. But leakage under the base plate, close to the stoma, and leakage outside the base plate is still considered leakage. And leakage is not something we should accept as ostomates, and it's something that you should not be seeing. However small amount there is behind that base plate, you should not be seeing it. And if you are, you need to be either speaking to your delivery company, somebody like Charter, or to your Stoma Care nurse. So what can cause leakage? There can be so many different causes of leakage, and these are just a few of them. Pancaking or ballooning. So pancaking, especially common with colostomies, is when your output is very thick, it sticks towards the top of your bag, it's not dropping down into your bag, and you get that literally a pancaking effect where it's just sitting there and the bag gets pushed off. Ballooning is almost what it says on the tin, the bag overinflates. So this can be if your filter has become blocked on your bag, or if the filter has become wet, or just sometimes excess of wind, where your bag is blowing up, and we've probably all seen it as ostomates, where your bag is almost pushing off your side. Diet, and this can even include things as your meal times. Some people can be very sensitive as and when they eat their food, as well as the types of food they are eating. As we already discussed earlier, changes to your body, changes to your stoma size or template, poor pouch emptying or changing routine, and then overnight leaks, which can be caused by not emptying the bag overnight. And at this point, I'd like to introduce you to my very special guests. I'm joined by Jess, Yvette and Alana. So, hi Jess.
Hi, I'm Jess. I've had an ileostomy since 2021, secondary to Crohn's disease and then rectal cancer. It's now a permanent ileostomy that I've got as well.
Thanks, Jess. And Yvette.
Hi, I'm Yvette. I'm a Coloplast ambassador and I have an ileostomy since 2013 due to ulcerative colitis. I had a subtotal colectomy, so I'm still waiting for my rectum to be removed.
Thanks, Yvette. And last but not least, Alana.
Hi, my name's Alana and I'm part of the clinical solutions team here at Coloplast.
Thank you so much for joining me, guys. Now, I know you just heard the presentation there. The first thing I want to talk about is really body changes. Any experiences, obviously, that Jess, Yvette, that you've had with your bodies changing over time. And then, Lana, I want to talk to you more about any experiences you've had with talking to patients. So, Jess, I'm sure you won't mind me saying, you're recently a mum.
I am, yes, a new mum. Little boy's 17 months old now.
Oh.
So, yes.
So your body experienced a big change over time, didn't it?
Absolutely, yes. I had a huge weight gain during pregnancy. I put on 20 kilos, or over 20 kilos actually. So, yes, it's quite a huge change, and to see that and then that impact that it has on your stoma is quite big. So
what changes did you notice at that point?
I think for me, it was the fact, obviously, as your bump grows, my stoma started to stick out a little bit more. And then I found that the kind of soft convex bag that I currently use just wasn't fitting anymore, as obviously my body went from being kind of inwards. I had a temporary stoma previously, so I've kind of got a long history of swapping bags and going from flat bags when I had my temporary stoma to then when they resited my stoma for my permanent stoma, they put it in actually, they didn't resite it, they put put it in the old stoma site, but it then meant there was so much scar tissue there that I went on to a soft convex bag, because I did have that sort of, as you described, a moat earlier.
Yeah.
That's exactly what it was, that moat. And then when I was pregnant, I'd gone from having this sort of moat around my stoma to everything sticking out and needing to go onto a concave bag instead. So it was a really big change.
So you kind of hear what I was saying there about the moated, and then that trying to, no disrespect to baby bump, but trying to wrap a football in a flat piece of
Absolutely.
paper.
And it was a large football, as I say, 22 kilos. So.
A 22 kilo football, that is a mighty football.
It really was, yeah.
And then, obviously, those 20 kilos have now gone. So what was the impact of you post-pregnancy?
Yeah, absolutely. I mean, I had, unfortunately, a really difficult birth as well, which then afterwards resulted in my stoma prolapsing a little bit. So then I gradually went back to that convex bag, but instead of going onto a soft convex, I needed a slightly deeper one at the beginning to kind of support the stoma. And now I've gone back to my usual bag. So I've kind of been full circle, really, from flat
You've tried everything,
to
haven't you?
soft convex to concave, back to deep concave, and now back to nice soft concave.
Yeah, so you've tried everything, haven't you?
I have, yes. Yeah.
And how about yourself, Yvette? Have you had any experiences with your body changing over time? Because obviously you've had your stoma quite a while now.
Yeah, I've had my stoma since 2013. So when I first had my stoma, I was really, really poorly. I'd been really, really poorly up to the point of surgery. Mine was emergency surgery. So I weighed 5 stone 5 when I had my surgery. So I wasn't a healthy weight. And then gradually over the years, it took me a long time to sort of like recover and then start gaining good nutrition, really, and then slowly putting back on that weight. So it was a good sort of 2-3 years afterwards. And then slowly I was finding that things weren't lasting as long, the pouch wasn't lasting as long. And then over the years, as I've become a more healthier weight, I've had to adjust my routine depending on how much weight I did put on.
Yeah, so you had to make those adaptations over time. So it was like we said at the very, very start, it's that a lot of people, especially with IBD, you often go into that operation so poorly, and you do inevitably then put on that little bit of weight moving forward, because you're, as you said, a very unhealthy weight at the point of surgery. And then did you have to change any products or routines at that point? I know you mentioned routine, but how about product?
Product I had to change. I had to add in things like paste, perhaps maybe changing my bag more often. But since I added the paste in, that got me back to, not changing the bag as often as I used to need to when those changes were happening.
And again, it shows that it's not necessarily just change of base, but sometimes it can be adding a necessary supporting product as well. So that's a really good point that you make there as well, Yvette. Now, Alana, I'm going to ask you, because obviously you have spoken to many patients on the phone over the years. Sorry, I'm making you sound really old there. Sorry.
That's okay.
And so what sort of questions do you get people asking when they're on the phone? What sort of concerns? I suppose, what's your trigger point to think, oh, this could be somebody whose body's changed?
Of course. So obviously the most common issue we do get is leakage, unfortunately. For us, it's really to dig deep and understand the body profile. And obviously we have questions that we really sort of dig into to understand the root cause of the issue. And for us, it's questions to also, obviously our ears are our eyes, really. So it's quite hard when you're not face to face. So it's really sort of thinking about, okay, what's the best way to describe a question? Because again, I could ask a question, but the ostomate might not understand. So it's sort of have a feel over your stoma. How does your spout sort of stick out? Do you feel your stoma through your bag? It's sort of looking down at your tummy where your stoma is located. Now, does that area there seem quite flat? Is it slightly rounded? Is there any obvious bulges or anything like that? So it's really, for us to dig as deep as we can over the phone to really understand the issue. But more importantly, when we do uncover any issues, just to point them in the right direction, whether that may be a solution with a product, but more importantly, making sure that they have the support from the HCP.
Yeah, really good that you said there about, and I think that's something we always need to remember is HCPs are always going to be there for people, but I think what you guys managed to do is absolutely remarkable. Like you say, your ears are your eyes. I nearly said it the wrong way around then. Yeah, your ears are your eyes. And it's those questions that it's not necessarily that that concern that somebody's coming, I say the primary concern being leaks, but actually it could potentially be it's a change in body profile.
Exactly.
Both of you two have experienced that, that's actually causing those leaks.
Yeah.
And I didn't say earlier, but I know that Yvette and Jess know this, that I used to have a stoma myself, and it was one of those things that you don't necessarily, you tend to think that once you're given that product, that's your product then for life. That's the product that you're going to be on. But of course, why wouldn't things change? If your waist size changes, you don't try and stick on the same pair of trousers, do you? So why are you going to try and stick on the same stoma bag when your waistline changes and things like that? Now, Alana said the dreaded L word there, leaks. This is where we're going to come to now. I always say that I've yet to meet an ostomate that doesn't worry in some way, shape or form about leaks. Even if you are in a very good routine, it's something that can always be at the back of your mind, I think. So, coming back to you, Jess, how's your opinion on leaks? How's been your experiences with leaks?
Yes, I mean, I really struggled. I think what you and Alana have both said about the changing of the products and actually speaking to members of the team when you need that support is so important. I think for me, I had my temporary stoma for 18 months and I used a flat bag and I had very few leaks. I think I had 3 leaks in 18 months. I had no issues whatsoever. And then when I got told I needed a permanent stoma, which was a good 10, 12 years later, I thought, well, you know, I know how to deal with this because I've had a temporary stoma. And then the first week that I had my stoma, after I was discharged from hospital, the bags just leaked constantly to the extent that I had 8 leaks in 24 hours.
Oh, goodness.
And it was all over me. And I just remember thinking, I can't live like this. And I was so disheartened. And unfortunately, I didn't have a very sort of supportive stoma nurse. I think they were very, very swamped at the time. They weren't particularly supportive in my local community. And I was just at a complete loose end. And I thought, I've had a stoma before, but
what's happening
different?
now? What's
going on?
changed? Yeah.
And I didn't know about different types of bags and anything. And I actually rang Coloplast and spoke to some of Alana's team who were just so good at being able to do and ask really specific questions. Like you mentioned the moat as one thing, and is your stoma sticking out? And obviously it turned out that my new stoma was sited in the same place as my old stoma. There was so much scar tissue there that there really was. It was really indented.
Almost pulled back a little bit,
yeah. Although it wasn't, I could still see it from when I looked down at my abdomen. There was a lot of indentation there, and there was no way a flat bag was going to stick to a heavily scar-tissued abdomen, really, was the bottom line. And it was because of the clinical solutions team that they mentioned they had these soft convex bags, and, you know, I was able to then try some samples. And it suddenly went from me thinking, this is it, my life's over. I can't leave the
do
house.
this.
I can't carry on like this, to suddenly just going out and doing everything as I was doing before surgery. And it made such a difference to my recovery. So, sorry, I think that's quite a long one, but
I think, and
it's so important.
what I love the point you make there is, like, and I said before, you think that is your one product.
Absolutely.
And it's that old adage, is it? You don't know what you don't know.
Yeah.
And I think most ostomates go in there thinking there is one type of bag, there's that flat bag, and that's it.
And they think they have to live with that and continue with that. And that's just normal to have all these leaks. And I think that's what's so important about us chatting today, really, isn't it? That leaks aren't normal. And actually, there's so many solutions. That mentioned the pace, that's not something that I've ever tried, but that's something that obviously has made a big difference for you. That there's so many different solutions and everyone's different, and getting that support is so important, isn't it?
And I think it's realising what is leakage as well, because as we saw from that graphic earlier, people don't consider that little bit just around the base plate to be leakage. 81% of patients don't consider that to be leakage. So it's actually making sure that it is very clear that it doesn't have to be all over your clothes to be classed as leakage. It doesn't have to get to that catastrophic point, because I think probably the 3 of us have been there where we've had those leaks where it's gone onto your clothes, and I'm not even being drunk, but you feel like your world has ended at that point. You feel like you don't want to leave the house at that point. And I always tell a story, and I'm going to shamefully tell it again now, where I was in bed overnight. I got ballooning because my filter had got wet. I woke up, it was everywhere. The mattress had to get thrown away. It was all over the bedding. But also during the whole drama, the cat jumped on the bed and was sick as well. So it was double drama. Well, actually, I suppose it was almost triple drama at this point. My poor partner at the time didn't know who to clean up first, whether it was the bed, the cat or me. I can obviously laugh at it now, but at that time, I was lying in bed, feeling like I couldn't move, just sobbing my heart out. Yeah. And you feel that everything is against you at that point. And I can't even imagine for you saying that 8 in 24 hours. I mean, oh.
And I think it's hard because for me, I knew that wasn't normal because I'd had a temporary stoma, but I did really feel for anyone that would have been in a similar situation who hadn't had a stoma before, who was then told, they needed emergency surgery, they had to have a stoma, that was it. And then they think, that's it, my life's over because I can't leave the house because I'm just leaking constantly. So it's really, really challenging if you experience that.
And I think that's an interesting point to come to with you, Vic, because obviously your surgery, as you said, was emergency. So what was your sort of awareness around leaks? What was expected? What was your thoughts at that point?
I'd already sort of been forewarned by my surgeon because he was kind of going through the pros and the cons, and he's like, you're not going to be living in the toilet like you were with your colitis. He says, but his words were, he says, there's going to be times when you're in the middle of Tesco and you are going to have a catastrophic leak. He says, but you'll recover, you'll get over it, you will move on. And he was absolutely right. And I have had catastrophic leaks. One, fairly recently, we were going to look round a local reservoir and something felt a bit weird and a bit off, and I thought, oh no.
Was it the itch?
It's the itch.
It's the itch.
But it was a bubbling thing that I'd never really experienced before, and I thought, it's a bit weird, what's going on here? And there was a catastrophic leak. And of course, I wasn't prepared, didn't bring any spares or anything. Went to the toilets, stuffed it with toilet roll, tried to make do and not sort of ruin the afternoon. But in the end, I had to cut it short because it was just catastrophic. But in that instance, it was to do with my routine. We'd been going out, rushed the bag change, and I've got a really decent spout on my stoma. And I'd rushed it and caught the stoma, and he'd flipped under himself. And then, of course,
he'd done the up and over.
Yeah, it leaked everywhere.
And I said that sometimes leakage sounds like it is user error sometimes. And is this sort of thing that you have to try and... How would you get that sort of information out, Alana? Because I can imagine kind of looking at body shape is a fairly easy thing, but how do you look at maybe somebody that's in a poor routine of changing?
Of course, it's quite simple, really. It's just sort of really asking, talk me through your bag changing routine, understand what they're using. And again, people use creams and things like that. They have different things that they use in their routine. So it's really good for us to understand, again, what they're using. But more importantly, have they been educated by their stoma nurse? Or again, people have had stomas for many years. So it's just re-establishing what good looks like for them. And again, maybe just taking things out. Sometimes less is more in routines as well. And just giving some advice, really, just to maybe swap some products or maybe take some things away to make sure that they've got a straightforward routine and nothing's bothering, again, the adhesive sticking down or how they're changing it or if they're applying the product correctly as well, which is really important.
I love that less is more factor. And I think there is a bit of it's like a bit of a fear of missing out. And I think within the hospital community, you see things online, you're like, oh, I think I might want that. And people tend to get a bit almost trigger happy with thinking they need all these products. And I say less is more. I'm also a firm adage, if it ain't broke, don't fix it. But people seem to want to add things in. And often then, back when I used to work as a healthcare assistant with stoma patients, often it's that deeper root cause that somebody thinks they want so, but is that actually a worry about something else? So, for example, one of the things that we see a lot is odour, that people want the odour. But as we all know, unless you've got problems with leaks, you're not going to have a problem with odour. So it's actually those sort of inquiring questions. And again, that's something, so I'm going to come back to you, Alana, like I'm going to switch it up a bit. What sort of inquiring questions do you use when you're looking at delving into those root causes?
I think it's more understanding where the problem is, when's it happening, how often, more importantly, diet, hydration, what they're having, what foods, again, I know you touched on that recently as well, but what they're eating, what they're maybe not eating, and again, medications and things like that. It really can affect the output and how the stoma functions as well. So there's quite a few questions we go into, but really for us in the initial sort of conversation is really understanding what the issue is, where it's happening, when it's happening, how often, and how it's really impacting you guys, how it's impacting you day to day. And then we can sort of delve in again around body profile, but more importantly about routine, whether that's bag changes, hydration, diet, medication, and products also.
Really good point. I'm going to come to you again now. I'm going back in the other direction now. It's like I've done a little boomerang thing here. Looking back at leaks, what hints and tips have you potentially got for people who's out there to help avoid leaks? Because I know that you said, I know it sounds like I'm picking on you, but your last leakage was your own fault.
Entirely my own fault.
So what would be your little hints and tips to avoid errors?
Hints and tips. Don't change your bag in a rush. Take your time, especially if you're a new ostomate. Take your time, go back to basics, start from scratch, think things over, make sure you're doing it right. But also things like food, I've noticed, things that are sort of quite highly acidic, so spicy foods, tomato-based foods, I tend to find they erode the base plate a lot quicker. So whereas normally, say, you would go maybe 3 or 4 days between a bag change, I find if I've eaten maybe a bolognese one night and then followed by a curry the next night, that actually my base plate will not last, so I need to change it more regularly. So it's paying attention to what you're doing, what you're eating, taking your time over a bag change. And even my very first leak, all those years ago, it was something so simple as using an adhesive remover wipe, and then I didn't then cleanse that off. So I stuck the bag on, went to bed, and woke up halfway through the night because it hadn't been, there was still a bit of adhesive remover left. So it's just really kind of taking your time to think things through, what you're doing, what you're eating, and just checking your routine.
I love that. Just don't rush.
Yeah, don't rush.
Take your time. How about you, Jess? Any hints and tips that you've come across over time?
Yeah, I mean, I think diet, as a vet said, is a really important one for people. Often people are scared to eat because they think, oh no, there's going to be more in my bag as a result. And actually that kind of irregular eating pattern can then result in people eating much larger meals in one go and then finding that it's a lot for the stoma to deal with. They might get a bit of pancaking as a result of that, or things like people not drinking enough. So really kind of basics, isn't it? And we're probably all a bit guilty of not drinking enough often. And then finding the output gets really, really thick as a result. So you then get some of that pancaking, which is more likely to cause some leaks. I think the other one as well is just reaching out for support. In that everyone's stoma is different, isn't it? And I think from my own experience of speaking to Alana's team, it's been so helpful to have that. And I think Alana mentioned something about creams earlier. And often it becomes a bit of a vicious cycle. I don't know if you see this, Lana, when you see people, when you speak to them, that they have leaks, the skin gets really sore, and then they think, oh, I need to put a cream on it because my skin's sore, which is what you do with other wounds, isn't it? And then it becomes that cycle because the bags don't stick. There's more leaks occurring.
A tub of Sudocrem comes out.
Absolutely, yeah.
Other creams are available, but you do get people reach for the Sudocrem.
Absolutely, and you understand it because anywhere else you had a wound, you'd probably do that. And your skin is so sore and itchy when you've got a leak, doesn't it? If it's really got onto your skin, I think that's where reaching out for the support and getting the right products is so important. That speaking to Alana's team makes such a big difference because everyone is different, and we probably all experience leaks, but for slightly different reasons often. There's some crossover, but there's also different reasons.
And I'm going to add that, and it's that importance of reaching out early. Don't let the problem exacerbate. Don't wait till it's got to the point where, unfortunately, where you were having to change your bag 8 times in 24 hours.
Absolutely.
The second you start to get any problems, reach out for support, be that to your HCP, your Stoma Care nurse. Reach out to Charter. Anyone that you can speak to, get that support early on, because it's always a far easier issue to deal with when it's early doors than when things are getting more exacerbated, because then the skin gets more sore and then it does become trickier. So that's one thing I would always emphasise to people: reach out for that help and advice earlier. Even if it just turns out that you are rushing a bag change and that's all that you need to do. It could just be that simple thing that somebody asks you one of those inquiring questions that Alana was talking about, and you go, oh God, yeah, I've not dried my skin properly after I've cleaned it.
In my case, my leaks got so bad that my whole of my wound around my stoma had completely dehisced. And so I ended up being readmitted to hospital for 4 days to have adequate wound care. And I suppose that is slightly my fault, really, in that I thought, okay, I've had a stoma before, I can deal with this, and I let these leaks continue. And exactly, you can manage. And then
actually that shows any stage of the journey as well, that although it was a new stoma for you, you were an experienced ostomer at that point. And it's not just about people post-surgery reaching out for this support. You could have had your stoma 10, 20, 30 years. If you're having issues, even if, as we looked at those pictures there, even if you're getting that little bit of a leak around the base plate, you shouldn't be. Reach out and get that support before it gets worse, because leaks are never going to just improve. No. If you're having a leak, there's obviously when you do something, but by themselves, they're never going to just improve. There's something that needs to change to make that improvement. Another thing I'm going to add in my little hints and tips section is what I had to do initially was set an overnight alarm to check my stoma, because I'd gone from not being able to sleep when I got my well, I always say Crohn's because I've got re-diagnosed Crohn's, but at the time it was diagnosed as ulcerative colitis, because you're constantly awake because you feel like you're running to the toilet multiple times a night. And when all of a sudden I wasn't in that pain having to rush to the toilet, I found if I wasn't careful early stages, I was sleeping through and waking up either on the verge of a leak or having leaked. So I always set, I think it was probably for about the first 3 or 4 months until my body got into that trigger mode, I used to set just an alarm for about 2, 3 o'clock. And even if it was just the tummy pat, we all know that, the seal, the little tummy pat there, just to give it a little check. And then my other hint and tip is don't ever try and change your stoma bag after you've had a bottle of wine. That didn't end well either.
I was going to say, is that first-hand experience?
Yeah, I forgot to do the bottom of the bag up, which is never going to go very far. To be fair, the actual bag was stuck on beautifully, but when you don't do the bottom up, it's pretty ineffective. So there's my other hint and tip for you all. Before we go, is there any other hints and tips regarding checking body shape or anything any of you guys want to say? I'm going to come back over to Alana.
Yeah. I would just say, recognise, have a look at the back of your base plate when it comes to changing, and have a little look to see if there is any seepage under there. I think it's important that as an ostomer, you're checking your cutting size on a regular basis, that you've got support from your local stoma nurse. But also, I encourage anyone to reach out to Coloplast and my team. They're great, and they're there just to help support you. And also, we have our own nurses as well in-house to be able to support patients with any issues that they might have. So I would just say, just regularly checking your cutting size and actually just recognising if you do have any issues at all, whether that be sore skin, leakage, ballooning, pancaking, all the things that you mentioned prior.
Really like that point of checking the back. The back of your base plate can tell 1,000 stories, I think, when you look at that back of your base plate, when you've removed it. Have a look. If you're seeing any faeces at all on there, that's a leak. No matter how much or how little, that is a leak.
And then it's normal. It's normal for that to happen. And that you're not alone. And that we're here to support you as well.
Yeah. Yvette, anything more from you?
I think just pay attention to yourself, your body, how things feel, what you're eating, what you're drinking. Just take your time. Everybody's different. So what works for maybe another ostomer might not work for you.
Yeah, really good point. It's not a one-size-fits-all.
Exactly.
As we said, it was over 600 different combinations of bags and supporting products out there. No one's going to be the same. And anything more from you, Jess?
I think what you said earlier, Hannah, about, when your trousers get too tight, you think, okay, maybe I need to try a different pair of trousers, whether I change size, up or down, whichever. And the same thing with your stoma bag. If you notice you're gaining or losing weight, does your bag need adjusting? Are you having more leaks than you were before? And just that question mark, okay, this isn't not normal. This isn't what's normal for me. So what can I change? And then reaching out for support. I think that I can't really sing Alana's praises, team enough, because they're so good and they've been such a difference to me that I hope that other people can feel confident reaching out for them.
That's really lovely. And thank you all so much for joining me. It's been absolutely brilliant hearing all your stories from yourself, Jess, and from you, Yvette. And Alana, hearing the support that your team can offer, it really is invaluable. Thank you all so much. Now, don't go anywhere, because shortly we're going to a live Q&A. Hello and welcome to the Q&A, and I'm delighted to be joined by a wonderful guest from that presentation. So I've got Jess, Yvette and Alana back with me. Hi guys.
Yeah.
Hello. Now we have had a few questions come through. So I'm going to start off. We've had a question. How can you accurately measure your stoma with a parastomal hernia? I think that's a really interesting question. I'm going to come to you first on that one, Alana.
Of course, yeah. So the best way that my guys sort of describe that over the phone is so with the backing, so before you're sort of taking off the plastic backing, we use that as a guide. Coloplast, we also send cutting guides out as well. They're free. And then would use that sort of standing in the mirror. So the mirrors can really help as well. So you're able to really look at your stoma quite closely, especially with hernias. It's important that you can get a mirror close by and pop that over your stoma. I think that's the best way, just to really check to see whether there's a gap. So ideally you want to see at least a 1 millimeter gap sitting all the way around that cutting. Now, if you can see there's a lot more of a gap there, that might mean that you might need to change that, and slimmer if it's too tight as well and you're not being able to see any skin showing. Either maybe contact your local stoma nurse, or just try and adjust it yourself at home. But we do have video guides and we have complimentary cutting guides that we can send out with instructions that can be really helpful. So it's that 1 millimeter that we want to be looking for. So that's kind of really how we will deal with that over the phone.
Yeah, I'm going to add to that. Really good point, Lana. It's to really check regularly, because your stoma can change shape quite regularly with a hernia. It can start to increase in size quite a bit. So it's those regular, don't automatically assume you're going to be cutting to the same size on a regular basis. Check it almost every pouch change. Just check, remeasure. That would be another tip of mine. Anything from yourselves, Jess and Yvette, on that one?
I think from my side, just making sure you reach out to that clinical team as well if you think you've got a hernia, because there may be an impact from other sides if your stoma has actually developed a hernia.
Yeah, really good point. Anything from you, Yvette?
I think I would echo what the other two ladies have said, that, yeah, just ask for help. Reach out to your stoma nurse or childcare.
Yeah, brilliant. Now, our next question, this has come from a gentleman with a urostomy. So this is, any practical solutions on how to gauge drinking volume to enable to carry out everyday tasks? Quite an interesting one here. Obviously, we can get those water bottles now, which I think are quite good. They're almost encourage you to drink regularly throughout the day. So that's always a good point. Now, I'm going to call on you, Jess, here from your day job, so to speak, because Jess is also a dietitian. Are there any practical tips that you want to talk about from that perspective as well?
Yeah, I suppose looking to see if you're feeling that you're getting dehydrated. So looking at some of the symptoms that you might see. So you're noticing that the colour of your urine in that bag is very dark or quite foul smelling. Are you finding that you're getting lots of headaches or feeling quite dizzy? Are you feeling that you've got a dry mouth? Because they would all be signs and symptoms that actually potentially you're getting a bit dehydrated and need to up that fluid intake. And as you said, Hannah, looking at how much you're drinking based on that bottle versus how much is coming out. So you're kind of fluid in versus fluid out in terms of balance, and that may tell us a little bit more about, do you need to be drinking a little bit more in order to feel a bit better hydrated.
Great point. Alana, is there anything that you would advise people from this perspective?
I think it's more just making sure that they have the correct size pouch as well with urostomy. With Coloplast, we do have many different sizes in terms of the capacity of the pouches, so maybe just looking at that to make sure that it suits the need of the patient. And I think coming back to Jess is just checking on hydration, looking at the colour of the urine to make sure that the body is hydrated. We do have a lot of collective devices as well that work pretty well with urostomy pouches, but it's really looking at the sizing and making sure that the bag that you have is correct and fits your purpose and need.
Yeah, good point there about collecting devices, because I think everyday tasks to me still involves being able to sleep well overnight. And if you're having to unnecessarily get up and drain your urostomy overnight, you're not accomplishing that everyday task of getting a good night's sleep. So use a collecting device, use a night bag overnight to help you out with that. I'm not going to pick your brains too much on this one, Yvette, because I know that urostomies probably aren't your strong point there. So I'm going to move on to the next question. Oh, now this is an interesting one. Can having an ileostomy cause poor teeth and hair health? So this has come from a female with an ileostomy. Now, from my perspective here, an ileostomy isn't often the direct cause of these sort of issues unless it's a nutritional factor, but often the underlying factors like IBD can be well known to cause issues with hair, teeth, things like that. So sometimes it can be more of the underlying cause of, i.e. the reasoning for you having a stoma rather than the stoma itself. Would you agree on that one, Jess?
Yeah, I think that definitely plays a part. I think I suppose there's a few extra elements that we'd want to consider as well. So, for example, with the hair loss, we know that if you're quite soon after surgery, hair loss can occur after a surgical procedure just from your body being in such a stressful state after having had surgery. Also, if you've got a poor intake after surgery, if you're scared to eat or you're finding that certain foods are affecting that stoma output, or you feel a little bit that you're still staying on that very kind of beige, bland diet and haven't really moved on from that, then it may be nutritionally you're not getting enough calcium, enough iron going in, which could have an impact on dental health or hair, or depending if you've had some sort of where your bowel's been resected with an ileostomy. So if you've had a lot of your small bowel removed, then that may actually impact some of the way that those nutrients are absorbed, which could potentially have an impact on hair or teeth. And the final thing, I suppose, is what we were saying earlier about dehydration. If you're getting very dehydrated on a regular basis, that can actually have a bit of an impact on saliva production in your mouth, which could then potentially, if that's happening long term, have an impact on your dental health as well. So it's all those nutritional factors as well, isn't it, related to the surgery? And if you're needing that help with that, then seek support from that clinical team.
Yeah, great. Anything from you about on that one?
Yeah, I think I would also add that depending on the reason why you've had your ileostomy, it could be that previous to surgery you've been on medication, particularly for IBD. Things like steroids, they can cause a thinning of bones, so including in problems with skin as well. So it's important to look at the causes, what you've been through before surgery and what medication that you've been on, because that can also affect things like teeth, hair, skin.
Really good point. Anything from you, Alana?
I think just touching on both points from these ladies, and I think for us it's really just guiding the patient towards their stoma nurse or their healthcare professionals, just to have that conversation to make sure that they've got that support.
Brilliant. Oh, we're going back to hernias now with our next question. So this is from Mel with an ileostomy, and we've got, how does a parastomal hernia affect fitting? Now, I think we touched on this in the presentation. I think these must have come in quite early. And it was, like I said in the presentation, it's like trying to wrap a football in a flat piece of paper. So you get that creasy effect. You can't get that smooth effect. And also, as we just mentioned with that previous question, it can be that regular change in stoma size and shape as well. So that can be two very much causative factors of how a parastomal hernia can affect fitting of a stoma. I'm going to come to Yvette first. Are there anything more that you would say on anything that a hernia will cause effects-wise?
No, I think it's just taking time to make sure that you are measuring your stoma correctly, and getting the right fit and the right type of product that you need to fit around your body shape. Yeah.
And Jess, because I know we spoke to you about with your own football.
Yes, my 22 kilo football. Yeah. Yeah, no, I think kind of echoing what Yvette said really with that is that your body does change shape over time. We all gain, we all lose weight at different times in our life, and whether that is having an impact on sometimes hernias as well. There's just measuring and speaking to clinical solutions about differences in bags that you might need.
Brilliant. So on the subject of clinical solutions, Alana.
Yeah, I think it's really important that obviously when you have your meetings with your nurse prior to surgery, obviously your hand is always something that's a risk and it is obviously talked about. So it's really important that if you identify that your stoma area has changed, again, like the lady said, so it's just really important that we're looking at the cutting size, but more importantly, reaching out for support if you notice something's not quite right, whether that be our team here at Coloplast or your nurse. To make sure that we've got the right product for your stoma. And again, bodies change all the time. As we said, they lose weight, they gain weight. So yeah, it's really important that we check that on a regular basis, including the cutting as well.
Yeah, and that goes back to, as we said in the presentation, checking that base plate regularly every time you remove it. So in that presentation, a base plate tells 1,000 stories. It will tell you what's going on at that point. You may find that there's a particular weak spot around your stoma that's where you're always getting the leakage from. So really just keep examining that base plate. And if necessary, it is speaking to your stoma nurse, Clinical Solutions, and maybe just getting some either additional supporting products or changing your products around. Then we have one final question. And this is probably going to be one mainly for yourself, Alana. So why can't we order new products without seeing a stoma nurse? I have to ring my stoma nurse at the hospital, but no one answers the phone. I've also tried to get an appointment with my doctors, but that is impossible. This is from a female with a urostomy. So what would be that reason why somebody may have to speak to their stoma nurse or see a stoma nurse?
So it's really important for us. There are multiple different areas of the UK that have multiple different agreements. There are formularies that will apply to certain areas of what can be and can't be prescribed. And again, that can be due down to the NHS and costs, which is really important. And it's really important that we're, in terms of the Stoma Care nurse, that they're able to make sure that whatever products that you want to bring into your routine or that you see or want to try, is that it's run by them so they can help support and make sure that that product is right for you. Especially with my team, which is why we do what we do, is to really assess to make sure we understand the issue and then we can make sure that you've got the right product. So it's really important that again, that the stoma nurse is with you and helping support you with that, but also with our team as well. But predominantly, there are a lot of different agreements in different areas. And again, it's just speaking with your local GP, your stoma nurse, to really understand what they are and having that conversation with your stoma nurse as well.
Yeah, really good response there, Alana. And I think it's important to also say that you guys do communicate with stoma teams as well. So that if people do need to call yourselves, you can communicate information to stoma teams. So I would encourage a person to get in touch with you guys, and then you can potentially speak to the stoma nurse team as well. Anything from you, Jess, on that one?
I think from my side, just to say that I think often it feels very unfair and we feel like we're met with lots of barriers, but actually it's remembering that GPs actually hold their own budget now and often have to pay for a lot of these products themselves and may not understand why we need a certain product. And I think Coloplast have put together a really good set of leaflets and letters in terms of patient rights, that if you're having problems with the GP, you can seek some support with that. Is that right, Hannah, that that's available for people now?
Yeah, and it's, I think we often forget, especially when those of us with the stoma, that these are prescribable items. It is a form of medication almost. So yes, there may be further questions asked. And you're right, it does feel unfair. It's for some people, it is taking away that freedom aspect, but it is ultimately a prescribable item. So there can, unfortunately, be some barriers along the way, which it can feel, like you said completely there, just very unfair and unfortunate. Anything from you, Yvette, on that?
No, I think it's just exactly what you said, is that, you know, if somebody was wanting to change their heart medication or their diabetes medication, they would have to contact their doctor or their stoma nurse because it is a prescribable product. And just because the stoma items are not medication, they are still prescribable products. So as much as it is frustrating, it's just the way it has to be.
Okay. Oh, and we've had one more question come through. Now, this is, why are there not more males speaking out and helping those that are new to an ostomy? And how can we improve the balance on male-female support? As we're a group of females this. But I just want to say that Coloplast we have a lot of male ambassadors as well. We do. Unfortunately, it was around availability, things like that, as to who could be available, things like this. But it's certainly something that we will take on board and try and get a mail in for the next one. But there are a lot of people out there that are willing to talk about things out there. And I think, Jess, as fellow ambassadors, you would agree with me on that one, that we are quite evenly balanced on the male-female.
Absolutely. I think there's a really, really good balance, and there's some very, very approachable men out there who'll be happy to answer any of your questions that are Coloplast ambassadors. So I don't know, Hannah, if there's information on the Coloplast page about ambassadors for people to contact that they could reach out to if needed.
And it's certainly so we can reach out to afterwards and get them in touch. We can always respond afterwards and get some details out there. And have we had any more? I'm just going to quickly check before we go. Oh, and one follow-up. Could barrier rings cause pancaking? Does the team have any thoughts on whether these items help or hinder with leakage? So from my perspective, barrier rings, if used correctly, should not cause pancaking. If they're being used incorrectly, they could potentially, if they're taking too much of a spout away from your stoma, yes, that could be the potential there, that they are causing too much of a flush effect, and it may well be that some convexity is therefore needed to keep that spout there on the stoma, because it's important to remember that your stoma needs a spout in order to create good output into the pouch. But pancaking is generally caused by the output being a little bit too thick, maybe a little bit too tacky. So there can be little tips like a couple of drops of baby oil in the pouch, squidged around a bit, can help it through. Or sometimes it can even be a lack of air within the pouch. And what a lot of people do, I feel like I'm doing this perfectly because I have got cold moment, a bit of a scrunched up tissue in the bottom of the bag to help break that airlock as well, can sometimes just help. But barrier rings should be a supporting product, therefore helping with routine and not hinder. Anything from you, Alana, on that?
No, you've done it. You covered everything on that basis. I think, yeah, it's just really important that the barrier ring is there to absorb moisture and to help barrier your skin from output from getting on there. Now, if you find that you have got a sear but it's not working out, there may be something, again, there might be a reason as to why that might be happening. And again, I think just reach out to the team here. Be more than happy to have a chat with you about your routine, and again, having a little look at whether that's the right product for you, but more importantly, again, how you're using it, because applying the product as well, making sure you apply the product correctly is really important, again, because we want to make sure it's being beneficial to you. But yeah, I think yeah, if you're finding that there's any output or seepage still getting under there, then I would advise you to sort of reach out to us or your stoma nurse, and we can have a little sort of conversation around why that's happening, and figure it out for you as well and help support you.
Thanks, Alana. Yvette, anything from you?
No, not at all. Just reach out. I think that's the most important takeaway piece of advice.
Yes, absolutely. Jess, are you echoing the thoughts here?
Yeah, absolutely. Reaching out, definitely. I think from a personal experience, I can say that I've tried several different barrier rings. I've tried initially, because I use a soft convex bag, but I tried a convex barrier ring, and that just didn't work for me at all. And I think that's the really important thing, is that everyone's stoma is so unique. It sometimes can be a little bit of trial and error. That although I used a soft convex bag, initially I tried a flat bag with a convex ring. It didn't work for me at all. But having the flat barrier ring has worked perfectly and has really actually transformed my skin and has made a really big difference to supporting the kind of reduction in leaks and my overall skin health. So it's just sometimes about getting the right product, isn't it? And I think that's where reaching Alana's team is so important to help with that.
Yeah, I think the overall message there, because the question was, should it help or hinder? A product should always help and never hinder with leakage. It should never be a causative or not helping regarding leakage. So I think we managed to get through all the questions there, ladies.
One more, Hannah, just around chemotherapy.
Oh, that one.
Someone's put about starting chemotherapy. Should they be using a different bag?
Oh, yes, that one is just good. So when starting chemotherapy, should I be using a different bag? And do I need to consider anything else? I have an ileostomy. So chemotherapy can, with an ileostomy, cause an increase in output. So it may well be that you need to look at a high output product for a short term, or even just a larger pouch for a short term. And But not everybody does get these high outputs. It's not a one size fits all, as we keep saying. Jess, have you had any experience with this yourself?
Yeah, so I think the big thing with it again is that everyone's different, exactly as you said, Hannah, and how everyone's going to respond to chemotherapy is different. We know that sometimes chemotherapy can have a bit of an impact on skin, so you might be needing to change certain products, and speaking to Alana's team about that would be helpful if you're noticing your skin gets a little bit sore. And Hannah, I think you hit the nail on the head with chemotherapy, often increasing output, and so sometimes it might be that diet needs adjusting slightly, but until you start it, you don't really know, and I think that's the thing, everyone responds so differently. So if you do need that support, then reaching out, that would be my thought.
Absolutely. Anything that your team would advise at this stage, Alana?
I think you guys would probably go through again just diet as well, making sure that the pouch capacity is large enough for you. Obviously, making sure that the drainable outlet's there, it's working, but making sure that the capacity is there. Just in case we might need to move up to maybe a maxi bag, maybe a bit bigger, just to give you that little bit more room so you're not draining it as often. But I think routine, diet, all of that, we would go over quite a lot over in the call. So I think, just reach out to us. The guys would be happy to have a conversation with you around that, and we can definitely support with regards to just maybe adjusting things slightly if we need it to.
Yeah, so as we've said, there's no hard and fast rule. It's almost seeing what happens at that point. And I just want to wish the person asked that question very well as well with their treatment, and hope everything goes well for them as well. Anything from you, Yvette?
I think also just make sure you keep a really good close eye on your skin, because any sign of soreness, you don't want to be getting an infection, especially when you're starting chemotherapy.
Yeah. Really good. Well, thank you ever so much, ladies. And thank you to everyone that watched, everyone that asked some questions. There is more information and some really useful resources for people on the welcome page as you came into the webinar. There's been some links for some resources there if you do want to learn further, including the body check tool, which we mentioned a few times as well. Thank you to everybody for watching, and we'll look forward to hopefully seeing you on another webinar very soon.